Good afternoon, everyone. We're live today at Sakra World Hospital, Bangalore. We have with us Dr. Deepak Gowda, who's a consultant, cardiothoracic and vascular surgery, who will be discussing with us queries on heart failure and heart transplant. Welcome on board.
So thank you all for inviting me to talk on this rarely spoken topic, which is heart failure and transplantation, which is the need of the hour in our country, especially because of the lifestyle modifications, because of industrialization and urbanization. More and more heart failure patients are walking into our clinic, and it's a very good topic to discuss on.
Okay, let's start with the questions.
Sure.
What exactly is heart failure?
Heart is basically a pumping muscle which pumps the blood to entire body, and which is made up of 400 crores of heart cells which are called cardiomyocytes. So any factor which affects this cardiomyocytes affects the function of the heart, which eventually leads to the pumping failure, which is called heart failure. And suppose we say if 100 ml enters to the heart of blood, if 60 ml is pumped out of the heart, it is called 60% of ejection fraction. When this ejection fraction falls down to 50% and low, it is called heart failure.
Oh, okay. How common is heart failure?
Uh, Sadly speaking, we don't have much of data in our country, but whatever data we have in the literature, it's roughly about 40 to 50 lakh people suffering with heart failure on this date, and this number is increasing day by day with what I mentioned, industrialization and lifestyle changes, and around 20 lakh people are getting added to these numbers every year.
And what causes heart failure?
There are many factors which affect heart failure. The most common one being the coronary artery disease, which is mainly the heart attack in a layman's word, and which causes heart failure in more than 30% of the population. In our country, especially, rheumatic heart disease, which affects the valves of the heart, which in turn leads to heart failure if not timely treated. Hypertension is another big cause for heart failure, and obesity, and few genetic causes of heart failure are also there, which is not more commonly seen in our country.
But off late, we are hearing a lot about this heart failure. It was never there. I mean, so much news about heart failure was never there before.
Not really. Yes.
What are the symptoms of heart failure?
So when a patient has heart failure, he walks into our clinic, his main complaints will be breathing difficulty. He'll not be able to do his routine activities. He'll get breathless. He'll complain of swelling of his feet
Okay.
because of fluid accumulation and bloating in his abdomen. He is not having the same hunger as he had before, loss of appetite, and they may also have constitutional symptoms like palpitations, dizziness, and frequent hospital admissions.
Okay. How can heart failure be diagnosed?
So, main diagnosis of heart failure starts with proper clinical history. So, when a patient walks into our clinic, we elicit his history, whether he had any previous heart attack. Uh, 50% of the patients who had previous heart attacks within 5 years develop heart failure. And uh, wa- we subject him to other investigations like ECG, echocardiography, and there is a special investigation called a blood investigation called proBNP,
Okay.
which is one of the hormones produced by the ventricular muscles, which is very elevated in a heart failure patient. We also have a MRI scan of the heart, which can exactly quantify the heart function. So these are the diagnostic modalities which we diagnose the heart failure.
Okay. Does heart failure mean that you need a heart transplant?
Not really. All heart failure patients need a heart transplant. So once they are having heart failure, we stage them based on their symptoms like A, B, C, D. Obviously, D is a end-stage heart failure which needs heart transplant. We initially put them on medical management, and see how they respond to the medical management. So we have got a few medications for heart failure. In the recent days, there has been a lot of improvements in these medications.
Okay.
And once these medications fail, even then the patient still has heart failure symptoms, then obviously he is a candidate for heart transplantation.
Okay. So, what is the maximum age for heart transplant?
This is a pretty controversial question. Not uh, uh, because it's a symptom of aging heart. So most of the heart failure patients are in their 60s and 70s. So we do have a cutoff of 70 years. So beyond 70 years, we tend not to do a heart transplant because of the outcome. And less than 70 years, any person is fit for heart transplant.
And what is a life expectancy of heart transplant patient?
Recently, there have been a lot of research and development in this field, especially, and lot of new tests and modalities have increased the life expectancy. I would say 50% of the patients who have undergone heart transplantation live beyond 10 years of life. Most of the mortality occurs just 1 year after heart transplantation. After 1 year, the mortality slowly reduces.
Okay. Is there any preventive measure for heart failure development?
Uh, as the proverb is, preventive is better, prevention is better than cure. So rightly said, prevention is better for the heart failure. There are a lot of preventive measures to prevent heart failure. Like basically, we have to change our food habits, and stress is one of the things which we have to avoid. Hypertensive and diabetic patients have to get their hypertension and diabetes checked and properly control their hypertension and diabetes. Obesity by weight reduction has to be done. And if they are diagnosed with any heart disease, they have to strictly adhere to the treating doctors, medications, and be on a regular follow-up of these recommendations.
Okay, with this, we come to the end of today's session. It was a very interesting session. I mean, I think most of the questions in our viewers' minds have been clarified today. If you have any queries, you can leave it in the comment section. Our experts will revert back to you. Thank you, Dr. Deepak.
Thank you very much.